Hello, everyone, and welcome to the Data Hunt Uninsured in America. I'm Tracy Flood. I'm president and co-founder of the Broad Street Institute. And today we're going to be doing a data challenge, creating a shareable portfolio project, highlighting uninsurance rates in your region. Now, depending on which portfolio project you choose, your region may vary. And we're excited to be showcasing a few different templates that we have here today. I want to thank everyone so very much for being here. This is a live workshop. We've got a bunch of people in the room. Super happy for you to join us. And for everyone we have in the room, we've got a bundle of people watching and following along on video. So if you're a video only and you're watching this recording, hello, welcome. The main purpose of today is to create a data challenge. This is the main objective for today. We're going to create a shareable portfolio project that is practical and real world applicable, highlighting uninsurance rates in your region. Now, we've got two different templates for the portfolio projects. We've got an infogram that can be used on Instagram and is designed to be in the style of word art with using proportions and fractions. And then we've also got a one-pager for elected officials. We'd love to encourage people to share data with those who can make policies that are impacting health. And so we do have a one-pager as well. These are our two portfolio projects that you'll get to choose. We're going to start with a few disclosures. This event is hosted by the Broad Street Institute. We are a registered 501c3 nonprofit. And first and foremost, we are a learning community, training the next generation of leaders in data-guided decision-making and evidence-based solutions for improving public health. We do a lot of exploring community data sources. We do a lot of exploring the different tech, mapping tools, et cetera. And we find that a lot of this practical application of data just needs a little bit more practice and exploration. So it was a community built for interns, by interns, for learners, by learners, and indeed 100% of the funding for the Broad Street Institute is from our learning community. Thank you so much to our donors who've contributed. And this event itself was requested, planned, and supported by our volunteer community, some of whom you'll be meeting today. Now, the community itself is about 140 people strong and has been running for the last 5 years or so. I think we've seen over 2,000 people within that learning community. So we're super happy to have you joining us here today. We believe that data heal the world if we share it. So we really want to take that practical approach to sharing data. And we do encourage you to reuse some of our templates and tools for your own work. And please consider sharing on social media and also with policymakers. Speaking of policymakers, we are trying to weave in civic education to all of our different events. And the one-pager for the elected official is in a style that's nonpartisan, non-lobbying education. So it should be safe for work if your work site limits lobbying. It's designed to be safe for work. All right, a few ground rules. We know that there's a lot of tension out there. We know that there's an ever-changing landscape. And what we really want to do here is to spread hope and to share solutions. So please be sure that when you're sharing and connecting with others, you're helping them, supporting them, and we're taking a positive approach to shared solutions in the future. We think that's really important. The outline for today is we're starting with this welcome, 3 questions. Who are we? Why are we here? What's the plan for today? And then we're going to be diving into the data hunt. This is a speed run tour of different data sources and is sometimes referred to as our grab and go portion. Then we're going to be diving into the data challenge, which is a little bit more hands-on, starting with a step-by-step walkthrough of all the different things you'll need to do in order to complete the challenge, starting with querying a data source, data.census.gov, collecting key indicators, really 1 or 2 indicators, on one geography of your choosing, and then creating a portfolio project, and you'll get to choose which path you take. And if you don't like one of our templates, feel free to make your own and share it with us. And then we'll try it in teams. So just watching first and then trying it in that second part of the data challenge. Then for the final 5, we're going to be wrapping up. And this entails connecting with others, sharing LinkedIn, and doing a bit of a recap on how it went in the breakout rooms. By the end of the data hunt, participants should be able to understand at least the scaffolding of the data ecosystem of publicly available data on this topic. And after the data challenge, participants will be able to query, collect, and calculate key indicators from one data source for one geography and create a data visualization to share with a target audience. The data visualization might be word art. The data visualization might be a bar chart in the one pager for the elected official. The idea is that it's created for an audience and is designed for them. And of course, while it's not a learning objective, we do have a bonus objective here, which is to connect. We are here, we are watching this, we share a love of data and information, so why not connect with one another? Let's build those networks. I think it's important. All right, starting with the 3 questions. Who are we? This is very existential. A little glamour shot. Tracy Flood. I'm president and co-founder of the Broad Street Institute. Broad Street Institute is a data training nonprofit organization. It is a remote organization. There's people all over the place, including all over the world. I am based out of Milwaukee, Wisconsin. I've got over 10 years of experience in community health data exploration and putting it into software as well, and also putting it into reports like a community health needs assessment. Right now, we are focusing on data training. We have 140, we have graduation this Friday, or so interns, 2,000 since 2020. And we run these workshops and videos every 2 weeks. We release videos and workshops. We're really trying to get the word out there that there's so much amazing data and there's so much you can do with all of the amazing data that's out there. So really, we believe that, so I personally believe that bringing data to the table as part of the conversation is the key to solving this generation's greatest challenges. We think it can bridge divides. We think it can create shared solutions. We feel very strongly about data, and I do definitely personally. I want to send a huge thank you to our planning team. We have Negar, Teresa, Kainat, Shamini, and Farheen. And also we've got support squad members not listed here. So it's Janelle and Diamond and a few others who helped us with the pilot. I want to give a huge shout out to Teresa and Negar, who will be running one of our breakout room portfolio project sessions today. And they'll share a bit more of an intro of themselves. But they've been helping us with these data events for a very long time, very into data training and a huge amount of experience between the two. Here at Broad Street, we come from all over and we share a common belief that data heal the world. We believe that when data is shared in a humanized way, people can visualize it and see it and explore it, then it really does catalyze conversation towards shared solutions. We really believe this. And of course, when I say data heal the world, what I mean is data people heal the world. It's those who give data a spot at the table and give data a voice. It's so very important. Sometimes we are a little bit, feeling like imposters in the face of so much data and so much to know. So I really do admire the courage of data people sharing information. All right, that's us. Why are we here exactly? Why are we here? Why us? Why now? Why are we here? Okay, we obviously believe that the sharing of data are incredibly important. We believe that health insurance as a topic is rising to the national conversation and will soon be on the floor of different policymakers, whether or not it's at the state level, expanding Medicaid, whether or not it's at the national level, thinking about the Affordable Care Act. We believe it's entering the national conversation. And this is a very big topic that is incredibly important, and it definitely varies by different regions. And so we want everyone to essentially know what's going on in your region, especially if you're talking to local policymakers. What's going on in your region? I think it's so very important. Super lucky to have each and every one of you here with us today going through it. Our big picture goal and our vision for the future is that if we increase community health data literacy or numeracy, then data starts to join the conversation. We can get more local data, more data on disparities by population, more regional conversations and coalitions talking about data, advocating for health either on a social platform or directly to policymakers. And then we believe and hope that that'll lead to evidence-based decisions, policies for health, and a healthier nation for all. So of course, we have a very big hope that our small data workshop will cascade into a very big change in the future. And who knows? Obviously, it'll take each and every one of us for this to happen. let's talk about the plan. Data hunt, the data challenge, step by step. Then we'll try it. Essentially, we're giving you the tools that you need for the data hunt. And then we'll start the data challenge. The step by step, we'll give you a little bit of a tour of how to complete the challenge. And then when you go to try it, it'll be boots on the ground and getting that muscle memory going. So of course, we can show you the data in the data hunt, but the only way to really understand and feel confident is to give it a shot and to practice. So that's the spirit of the data challenge, is to practice trying, making stuff. All right, so this is what the plan looks like. Data hunt, step by step, trying it out for ourselves. And the data challenge is the last two parts. All right, let's go on a data hunt. Going on a data hunt. Speedrun tour of data resources. Why look at uninsured? We are not going to spend a ton of time on why look at uninsured. There's some great resources out there. We will not do it justice, but we're going to talk about the data ecosystem and where we can find data. That'll be the thing we spend the most time on. Why uninsured? Health insurance. This will not surprise you. Health insurance is an incredibly important upstream social determinant of health, with a ton of evidence showing that's associated with downstream health outcomes. So upstream, downstream, how does it flow? Now, the biggest thing is that it has been associated with premature mortality. Populations that have low rates of insurance do not live as long. There's so many preventable things that are not managed when health insurance is not on the table. It is so important. This is an evidence-based solution. I don't know if that will surprise anyone here, but of course, that's why we're talking about it. It's a social determinant of health. It's one of many. So County Health Rankings does a beautiful job of laying out how all of the different social determinants of health flow downstream to length of life and quality of life and clinical care, including access to care through health insurance and or through location of those healthcare resources is so very important. So whether or not we can get access to care because we're insured, whether or not we can get access to care because there are facilities nearby, County Health Rankings looks at that. All right, let's look at the data ecosystem specifically for the indicators of uninsured. Now, how do we find those who are uninsured? Health insurance companies have a lot of data, don't they? But uninsured populations are not in those data systems because they do not have insurance. So we rely on asking people through national surveys, do you currently have insurance? And if the answer is no, they get coded as uninsured. This will not surprise you, but there's also other ways for us to collect the data. So for instance, through birth records, if the birth occurs and those who were pregnant were not insured, that's one of the ways we can do it, through vital records. The other thing is if people go to the hospital and those hospitals collect discharge data and they have a list of discharges of those who are not insured. So that's another place that we can find this data. So really it is a bit of a data hunt to try to find these data sources, but they do exist. Now, often they exist, they might only exist if we're doing a survey. Maybe the survey is only on a sampling for the state. And so then you need people to do calculations, to do small area estimates, to try to bring those state level estimates down to the county or city level. So you find that in this data ecosystem, there's a lot of people doing extra calculations to turn that survey data into very, very localized data. So it's not just a national estimate. All right, then you've got the curators. The curators are pulling together all of the different data sources or select numbers of data sources. Some of them have very tightly curated indicator lists, and then putting them all together, and you can view them in different ways, in maps and graphs, etc. So the curators do all sorts of things with the data, but the main gist is that they're pulling from different data systems. So we've got the originators of the data, those collecting and calculating the data, as well as those who are curating the data as well. Sometimes the survey creators are the calculators, sometimes it's different people. This is the data ecosystem. Examples of this national survey include the American Community Survey or the Behavioral Risk Factor Surveillance System. And then you also have calculations and small area estimates programs like the Small Area Health Insurance Estimates that uses data collected from multiple sources, and the places data. All right, so BRFSS data becomes places data once it is small area estimated from the state level down to the local level. You don't have to memorize that, but just know if you start to see some indicators that look a little bit similar, that's why. Now, what's an example of a curator? So one of my favorite curators is the CARES Map Room under the University of Missouri. We'll be looking at them right now. So I definitely agree that local data is harder than state and national data to find. So we've really placed emphasis on local data sources. So where can we go lower than the state level? The state level is just too broad. And when you're sharing data at the state level, often people just attribute it to the biggest city in the state rather than the local region. So yeah, we really love local data. So let's go in. We've got sources of data. We've got related sources of data, not health insurance per se, but things that are related to health access, and then curators of data. So that's when the CARES map room will come in handy. County health rankings, congressional health district, they are very precise on which indicators they choose. I have a curated list of indicators relating to health outcomes. CARES map room has it all. All right, let's go in. The CARES map room is out of the University of Missouri. All right, sources of data. We are going to freaking fly. Sources of data, data.census.gov. Let's go. This is the main source that we'll be looking at today. So I'm not going to spend too much time here because this is my favorite data source. And here's why. Data get very, very small when you're looking at American Community Survey data by the US Census Bureau. They go to very, very small geographies. You can do neighborhood characteristics here. You can define your neighborhood with census block groups. It's so itsy bitsy. All right, small area estimates program. This one is a more robust, more accurate estimation, as you might say, by the US Census Bureau, but it's only to the county level. They don't go super small on it. It also can be accessible through data.census.gov, and there's also alternative ways to view it, like this dashboard here. You can select your counties from here and then go for it. County level data. Whoop. All right, so then the Places Project. This is the behavior risk factor surveillance system that is then calculated to be very small indeed. They go to the city level and in some cases even smaller. So they ask people, are you insured? And depending on how they answer, then you can zoom in and see. So the places data, this gets very granular and you can see it by, gosh, what is that? Census tract and then the city of Milwaukee too. So places data does a great job. Now remember, these are small area estimates and just estimates. People have been asked, do they have health insurance? And then based on their characteristics, it's been estimated at a smaller level. All right, healthcare cost utilization project. This is a different style of data. These data are from hospital discharge data. Some states collect all payer, all claims data and submit it to a unified database where HCUPNet shows this information. Very few people use this data source, and I wish more people used it because honestly, it is one of the best sources of data, like real data. And when I say real data, I mean, it's not a survey where they've just been estimating it. It's essentially the discharge data. So one discharge is one data point, essentially. It's not one survey equals multiple people. So you can do a 3-year time span. Now, the hard thing with this one is that it's a little bit clunky to use, but once you get the swing of it, then you can really look up a ton of different things. You can look up coronary atherosclerosis, for instance, or things that are related to heart attacks. And then here's the keys that you want to look at it in detail by payer. And you can see how many uninsured discharges there were, the average length of stay, the cost of stay. If you're trying to make the case for resources used and uninsured, uncovered hospital stays, then this is a really excellent source of data. Not all states have this. It is up to the states whether or not they report it. Hopefully your state has it. Next data source. Birth records, CDC Wonder. Another source of data that is not survey data are our vital records here in the United States. You can go into the birth records. This is an extensive, incredible data source. If you have not used CDC Wonder to look up different data sources and different things, then please do. All right, so this is all of the births in the US. It doesn't show all places. If the numbers get a little bit small, it doesn't show all places or report the data, but you can look at the source of payment for the delivery. Obviously, this is a very thin slice of the population. It is those who are giving birth, but you can see where self-pay becomes a challenge. Now, a lot of states do cover births, and so this might show you where some extra coverage might be needed. All right, and then you query it. We're not going to go into detail there, but it is a cool resource. All right, the uniform data system. This data source is lesser known because it's only data from health centers that are funded by HRSA. So for instance, federally qualified health centers, they have what's called a unified data set, and they share a lot of data through those data sets. Now it is a data download, and I actually recommend if you're looking at this data to look at it through CARES, which we're going to be going over in a second. Related sources of data include the shortage areas, health professional shortage areas. Now, this is not uninsured per se, but this does show where access to care might be an issue. And you've got different ways to explore health professional shortage areas for primary care, for mental health, and dental care as well. All right, let's look at the curators of data. By far, one of the best, most extensive curations of data is the CARES Map Room by the University of Missouri. Very few people use this. Why do so few people use it? It has an incredible amount of data in it. And honestly, most data hunts should start here. So if I just look up insurance, then I can group the results by the source of the data, see all the different data sources that there are, look at all the different data sources that they have. This is where the facility data are. You can also look small area health insurance estimates. Remember, these are data curators by poverty status, by gender, by age. Look at the uninsured. And then you just go boop, boop, onto the map, view the legend, and there it is. You can adjust the opacity. You can adjust the granularity. It is so unbelievably cool. Why aren't more people using this? It is so awesome. Please go to the CARES Map Room and explore their vastness of their data. It is kick-ass. All right, a very different vibe are county health rankings that look at a very curated list, an indicator list of data sources that are relating to health down the line. So county health rankings has a ton of data. You can download their data sets. It's a huge data set. It's an awesome Excel spreadsheet that you can do. And you can look up data. This is not usually the way people do it. Usually they go by the county health rankings themselves. So let's go Milwaukee, Wisconsin, and you can start to see the numbers. They have changed over time. Tables, maps, graphs, methods. This is the coolest part about them, is that they share all of their methods. Awesome. And I'm going to loop back actually, because the CARES Map Room also shares their methods. Boom, boom, boom. And over here, you can see if you just look at this little eye. All right, sorry, can't quite not tell you about the CARES Map Room. So let's go back. Uninsured. Okay, so if you are making the case for health in your region, then I do recommend County Health Rankings or Congressional Health District Dashboard. Now, this is for DC districts, so you can look up their metrics. You can look up all of the different metrics that they have. Again, a curated list, and they give really great justifications for why they include the data that they do. So here it is by congressional district, and you can see more about this metric, why they chose it. I love these tightly curated lists. They really provide an excellent background of why I look at this indicator in the first place. What are the limitations of this indicator, strengths of the metric, the limitations of the metrics, strength of the metric, the limitation of the metric, how they calculated it. They're really, truly great sources of curated data relating to downstream health effects. If I have not named something, then feel free to add it here. Boom. Thus ends the data hunt. Hopefully by now you can understand the data ecosystem, publicly available data. We're now going to go into the data challenge where participants will query, collect, and calculate key indicators, and then create a data visualization. We are here. We have done this. Boom. Now we are here. Let's go. Let's start the data challenge. The data challenge is to create a shareable portfolio project, real world applicability, highlighting uninsurance rates in your region. 2 different portfolio projects to choose from: word art in the form of an infogram that can be shared on Instagram, and then also a 1-pager for an elected official. We are actually choosing the elected official as a state level senator to showcase the detail of data that you can get using our one data source, which is data.census.gov. We believe that this objective is a SMART objective. We've got 1 project, 1 data source, 1 geography, pretty much 1 indicator with a few little extra calculations along the way. And we're going to be tracking everything in our challenge tracker, a big spreadsheet. I was going to say Excel spreadsheet. We're going to be just measuring everything in our challenge tracker, which is a Google sheet. All right, we do believe it's achievable. We've timed it. it should take about 20 minutes. If you hit a roadblock or you get to exploring, it's okay. If it takes you longer, that's all right. No judgment. We think it's aligned with our big picture goals, and participants are here and the support squad is here to help. It is time bound. Now, actually, we are going to try to finish this in the workshop session, but the challenge itself ends in 3 days. Have until Thursday midday, it is Tuesday right now, to complete the challenge and to make sure that your link to your portfolio project is in the challenge tracker. So everything that we're going to be doing today is using free tools, and we'll be sharing all of these different resources as well. If you don't yet have a free Canva account, you should get one. It's a cool tool. Very cool indeed. If you're affiliated with a nonprofit, then, oh my gosh, register on Canva. They give you a pro account for free. All right, this is what the 3-day challenge looks like. Midday Thursday. Boop, 3 days. Let's do a watch and learn. Now, the watch and learn is going to be split into 2 different parts. Here, we're going to learn about the basics of querying data on data.census.gov. Then we're going to enter the indicators into the one geography. Then we're going to create the portfolio project. For those here in the live session, the portfolio project will be split into different conference rooms based on which portfolio project you are choosing. So this step-by-step is actually split into 2 different rooms. And let's ask right now. So right now, would you be able to say 1 in 12 people are uninsured in my city? Would you be able to say this, do you think? Just want people to think about which steps we will likely need. Yeah, would you know that it's true or not if I asked you? Let's do the step by step. So the idea of the step by step is that got the tools that we need. We've got the data source that we need. And our goal is to create a shareable portfolio project. We're going to start. The first step is to know your audience and the geography that they'd be interested in. If you're working on an infogram, maybe a city or a county would be of interest. If you're talking to an elected official, definitely their constituents district is the most important thing to them. So know what's important to the person you're talking to when you're sharing data. Then we can query the data source and see what options are available to us. Collect the key indicators if we're able to find them at our geography of interest, and then grab the template. If you're creating your own template, it's helpful to know what data exists out there as you're creating the templates and go through an iterative process of making sure the templates and the data match. There's 2 different base camps here, one for each portfolio project. And then finally, you're going to add data to the templates. That should get you to completing the challenge, which is grabbing that link for the finished product and putting it into the challenge tracker. Now, when you go to try it, we're going to lay out these steps for you. You should be able to have an idea of what your audience and geography is going to be, and then you follow the steps to do it. All right, first let's do the watch and learn. Step by step, know your audience and their geography of interest. Query the data source, collect the key indicators, get the template, add data to the template. Success. We're on the verge of doing this data. We're about ready to see quite a large spreadsheet. Now, there is something about data that kind of scares people away. I don't know what it is about data. I don't know what it is about spreadsheets. It gives people kind of this do not trespass feeling, especially if it's kind of like an ugly download. People are like, ooh, I don't have permission to try this. So I myself struggled with imposter syndrome as we were starting to look at data. My own background is in medicine. And so I came to data through a slightly different route. And it is not uncommon for people who are trained in something to come to data through a different route. So please know that all of these different data sources, the code books are vast, data sources are vast, health as a topic is truly vast. I think it's okay to be in awe and to feel humbled and to have a little bit of imposter syndrome just to kind of hold on to that humility while also still sharing information and learning how to communicate data. So the why I'm telling you this is if you're feeling a little bit impostery or you get a sense of like, oh, I don't belong here in this data source, I assure you that you do belong and you can try out data and they'll have the tools that you need to accomplish this. All right, so let's go. Challenge tracker. Okay, here we are in the challenge tracker. I will start the process of the challenge tracker before I'll be going into your breakout rooms. And it'll look a little bit like this. So we're going to start out by just claiming a name. You will not claim it yet. You'll wait till the team room assignments, but I'm not in breakout room. So I'm just going to say Tracy Flood. I have claimed my thing, claimed my row, and I'm not in a breakout room. I'm going to send, let's see, a one pager to, yeah, I'll send a one pager to my Senate district. And I'm going to choose the Wisconsin Senate District 3. I happen to know that's my district. All right, so now I'm going to use this quick link, which is also referred to as a webhook. I'm going to copy and paste this into my browser. All right, here I am in the query system of Census Bureau. Now, if I were to start in US Census Bureau, I would actually start here and I can do a query for uninsured, but I use that quick link. So it's going to look like this instead. Now, I'm going to give you a little bit of a tour of this data system. Some of you, it sounds like, have used it before. The data system tour is as follows. So here we've got filters, and then we've got the results, and all of these different little accordions are happening here. So if I close this accordion, it'll just show me the table, and I can also start out actually with the filters as well. So if I go to the filters, I can see all of the different geographies that I might be able to query, the different topics as well, different surveys as well, including the American Community Survey. And I'm looking to see if the small area estimates program is here. Oops, it's not. All right, and then I can do the year. Oh, wow, that goes into the future. All right, so usually my default is American Community Survey 5-year estimate. It's a bit of more of a robust estimate. And you can look at all the different data tables that have uninsurance in them, and then also the different data products as well. So here I just want to be sure that it says 5-year estimates. I think that's a more robust, and it takes you down to a smaller geography if you ever need it. Just really like that 5-year estimate subjects table. All right, here now you can see that I'm going to close these accordions, and let's grab the data for the United States. So the very first thing I'm going to do is I'm going to grab the total estimate. So this is the total number of civilian non-institutionalized populations or people in the United States. And I'm going to pull it over and just make sure it's the same as here, my little benchmark. Okay. And then I'm going to also look at the percent uninsured. Here's the percent insured. And actually what I'm going to do is I'm going to change the columns and edit the columns down. I'm going to reduce the margin of error for here. All right, percent insured. I don't care about that as much as I care about the number of uninsured and the percent of uninsured. Okay, so that gets me to the data that I need. Now I'm just going to run this for the United States, and then I'll let you choose your region within your breakout rooms. So number of uninsured is here. I'm going to put that here. Boom. Looks like it matches. And then the percent uninsured is 8.6. All right. Now that I've grabbed that, I'm actually going to grab this, which is the query link. I have not added any geographies, but in your breakout rooms, you'll be adding your geography of interest, either by summary level or geographic entity. Sometimes it's really fast, just do a little bit of a search, and then you can see you want the city of Milwaukee. All right, so once I have that, I'm going to copy and paste this link in. This will be used for reference for later. It'll save my query essentially, which I think is so very cool. All right, I'm going to cite it, 5-year estimates. I did use a subject table to S2701, and I'm going to say that I got it. All right, now here's where you get into the phrases that are pre-calculated using different formulas. You can see the different formulas are here. And we say whether or not it's high compared to the national average. You can say whether or not it's higher than the national average by 2 times or more. And then you can see if 1 in 6 people are insured. So this is all using different phrases of the same data source. And if you're interested in the calculation that we used, it's here above. All right. And then you can take the little link to go find the information. And then choose to edit the template. That's as far as I'm going to go, because we're going to now hand the mic over to the different breakout rooms. And you can see that there's different prose examples based on what breakout room you end up doing. And then this is reserved for admin use. All right, that's the spreadsheet. Let's pause there and then go to our different portfolio sessions.
Hi, my name is Negar, and I'm a member of Broad Street Institute, and I love working with data. I'm going to create an infogram for colleague. Now we're going to census data, table S2701, that is health insurance coverage. So you can click the link here, column F to go to that website. I know that I want to look at Dumfries in Virginia, and for Infogram, we are looking at the places on census data, which includes city, towns, and villages. We'll go to geos or places on the left side menu, and then you can type the area if you know, or if you don't know your area, you're going to select place here, and then choose the state, and then the town, city, or the village that you are working on. So I'm looking at Dumfries, Virginia. I want to know the total population for that area. So it's 5,749. I'm going to copy this number, paste it in column G, then go back to the census data, and then look for the number of the people that are uninsured in that area. So the number of uninsured is 776 people. Copy this number, and then paste it here. So the uninsured person, going back to the census data, and here is the number of percent uninsured. Copy this number, and then go back to the Google Sheet, and then I'll paste that number. Then I'm going back to the census data. I'm going to copy the link here, going back to the Google Sheet and paste this link here. I'm going to check for the citation. So I'm looking at 5-year estimates, table S2701 for 2023. If you need any other citation format, you can go to the census data, click more tools, and then cite. So here the different styles come up for you if you need like a detailed citation. But for now, the one that is on the tracker, it's fine. And then I'll change the status to got it. I'm just going to compare the data that I got. So for the Dumfries in Virginia, the uninsured rate is at 13.5%, and compare that to US benchmark, which is 8.6%. So the uninsured rate in Dumfries is higher than the US benchmark. We can go to the Canva and Canva. So for the Canva, we're going to click on this link. That should take you to this template here. We're going to click View Template, open in Editor. There are so many styles and design that you can select. If you're sharing your template in social media, there are 2 different sizes. So make sure to grab the one that is for social media, which is this one, video MP4 1020 pixel by 1920 pixel. And then for the Instagram, it's the other template. So you can select the design here. I'm going to choose this style design. And then here, when you enter the numbers, you can see that it's mentioned that the percent of uninsured in Dumfries is high compared to US. It's about 14%, which is 2 times the national average, which means 1 in 7 people in Dumfries are uninsured. So I'm going back to the template, change this to 1 in 7, and then change the location to Dumfries, town, Virginia. And that's it. Then I'll go to share, change this to anyone with the link, copy the link, go back to the challenge tracker and share the link here. And that's it.
Senator, I'm part of started. The deliverable for most states, their state government is structured pretty similarly. So there's an upper chamber, which is the Senate, and then there's a lower chamber, which is like the Assembly or the House of Representatives. The exception to that is Nebraska, which only has one chamber rather than two chambers. The first step is to find your local legislator. So the audience that will be sending these infographics to will be our state senators. So it'll be your representative in the upper house of the state government. So to do that, I'm going to be using this website. It's Plural Policy, but here I'll enter my address. For this demonstration, I'm not going to put in my home address, but I'll put in the address of my office building, which has the same state senator anyway. But for y'all, put in your home address so you can find your state senator. So my office building is this. So I hit search, and then I scroll down a little bit, and you'll see the section called State Legislators. And I'm looking for the one that says the upper chamber. So for me, Boris Miles is my state senator. He represents District 13, which is where I'm in. So that's the first step, is to find who your state senator is. Your whole state should basically be divided into different districts. So like you can see here's the map for Texas. Each district is designed so that's roughly the same population, and it's just a bunch of squigglies basically that divides the whole state into different areas. Each senator represents a different area. So I am right, well, I guess it's a little hard to see, but I'm right like there-ish. So anyway, so that's how you find your state legislator. So next the next link should be this challenge tracker spreadsheet that Tracy also shared. Here is where we'll be entering in the data. So when you click on this template, you'll see the screen that shows a template was created for you by Broad Street Institute. Scroll down a little bit, and then you should be able to click this View Template button, and then open an editor. And what it'll do is it will create a copy of the template in your Canva account. If you don't have a Canva account, feel free to create one. There's like a free version. Create an account for free, but there is a premium version if you want to use more features. We do not need the premium version for this exercise, by the way. Okay, so when you create a copy of this template, you'll see several pages down here at the bottom. There should be 6 pages. The first page is a welcome. Second page is like kind of tells you what indicators that we'll be getting, which are the total population, the number of uninsured, and the percent uninsured for your Senate district. The third page is an example for Tracy's district of Wisconsin State Senate District 3. And then the fourth one should be a template that you can edit. Okay, and then the fourth link should be to the census website that Tracy showed you earlier. And you can see here a kind of similar interface to what she showed. So each row represents a different category. So you can see the different categories here. We'll be using the total, which is like all civilian non-institutionalized population. And then each column here represents a different metric. So here is the total, here is the estimate and the margin of error for the number of insured people, estimate and margin of error for percent insured, you have number of uninsured people, and the percent uninsured people. Okay, so at this top here, you can see where it says United States, and so that tells you that the numbers that show up on the screen right now are for the United States. Now what we want is to get the number for your state, for your Senate legislative district. So to do that, I'm going to click on this filters button here at the very top left. So I'll click on filters, and this thing pops up of just like all these different, there's a bunch of different filters that you can apply. For us, we'll be clicking on all geographies. Each row represents a different metric. We'll be using total civilian institutionalized population, and each column represents a different metric. So we'll click on filters at the top left. Then we'll click on all geographies so we can look at all the geographies that the census has. And then here, all the possible geographies that they have will pop up. And you can scroll down all the way to state, legislative district, upper chamber. When I click on that, it'll let me to choose what state I'm in. So I am in Texas. And when I click on Texas, then I can choose which district I'm in. So I will choose 13 for me. Okay. And then I clicked on that. And now there's these little two arrows here that will collapse all this filter, these filter screens and go back to the table. So I click on that to go back to the table. And so now here you can see at the top it says State Senate District 13, 2022, Texas. So make sure that this says the district that you are in. And I'll scroll all the way to the right. First I will get this number, which is the total number of civilian non-institutionalized population in my district. Then I will scroll to the right and get the number of uninsured, which is 239,557. Okay, and then let me go ahead and enter that into the Texas State Senate District 15. Enter that into the challenge tracker. Okay, so total population was that. And number of uninsured is that. Okay, and notice that it automatically calculates the percentage uninsured. And you can also check and make sure that that's the same number that shows up right here under percent uninsured. Sorry, let me put this in light mode again. Yeah, so in the chat, Diamond says that you should, if you don't use the 5-year estimate, you should be using the 5-year estimate from 2023. The link that I shared should automatically take you to the 5-year estimates for 2023. But thank you, Diamond. But make sure, yes, also make sure this says 2023 5-year estimates. So that's the 3 numbers that you need for in the challenge tracker. A lot of this kind of autofills, so you can see that it autofilled to show that this is high compared to the US average. It's about 3 times the national average, and about 1 in 4 are uninsured in my district. So now, going back to the Canva, I can go ahead and take all of these, the numbers that I found and the ones that were auto-calculated for us, and just put that into this template. Fill it in, delete all the arrows, and then download the infographic and send it to my legislator. So to do that, I can click on Boris Miles, going back to plural policy, click on Boris Miles, scroll down a little bit, and the website will tell you what their email is. And so I can go ahead and email the infographic to them after filling out this template. And with that, thank you for listening.